Joining us now is Dr. Donato Balsamo, and we're going to be talking about three topics: obesity, diabetes, and preventative care. Welcome to the show. How are you today?
Thanks very much. I appreciate the invite.
It's nice to meet you in person.
It's a pleasure.
I've heard great things about you. One of the things about your journey is why you chose to go into medicine. So can you share that with our audience?
Something that I always wanted to do since I was a young child, I don't really consider it to be a job. I enjoy what I do. I find it empowering to actually educate people, and it really is very rewarding to see people take control of their own health. And when they come back in and tell me how much they feel better and they look better, that is very rewarding.
At what journey should we be responsible for our own preventative care? Is it when we go away to college? Like, at what point does it dawn on us like, oh, I'm responsible for me now?
From day one, really. Certainly as a teenager, you kind of think that you're infallible. As you get into your 20s and 30s, you think that you know everything. But studies have shown from the Center for Disease Control that preventative care, especially in young adults between the ages of 20 and 39, can actually save thousands of dollars.
Okay. And so that's what it is. It's the financial, turmoil that happens to a family, right? Where if they would have done things correctly, they could have maybe prevented major illness from happening.
It's the finances as well as preventative. So preventative medicine is really geared towards diagnosing something very early on before it can cause other complications, or maybe in a very early stage where it's a lot easier to control rather than have it affect other body parts or other organs in the body.
And I think skin cancer is one of those things, right? You might look at something and you're like, yeah, you just don't know, right? That's one of the things that if you got something checked, or your teeth, because like your gums, like you can get like something like illness goes through your gums, it gets into your bloodstream.
Absolutely.
What are some other ideas of preventative care, like things that you should try to catch or nip in the bud?
The National Institute of Health has said that regular cardiovascular testing can actually save millions of dollars a year.
Okay.
That diabetes, and if I could just take a look at some statistics
absolutely.
here. Right now, the U.S. has 37 million people who have been diagnosed with diabetes. That's about 12% of the population.
Wow.
And it costs $18,000 a year to take care of diabetic patients. So it's a huge, huge burden, not only on people, but certainly on our financial healthcare system as well.
A lot of times too with diabetes, if it goes too long, you can lose a limb. Like some of these things, like they just are progressive, they're difficult, they're nasty, and a lot of times you'll see somebody like wearing a boot or whatever, and it's painful. Diabetes
so
can
ironic
be painful.
That you just mentioned that, because on my way here, I got a phone call from a patient of mine who's a young gentleman, he's 52 years old, has had diabetes about 25 years, never took care of it. Now he actually has to go to dialysis 3 days a week, 8 hours a day, because his kidneys have now failed from dialysis. So a little bit of prevention can certainly prevent those types of complications.
What do you love best about your job?
Educating people.
Okay.
Really kind of helping them understand what's going on, maybe trying to minimize some of the fears that they have. Nobody likes to go to the doctor for the most part. Most people go because they have something wrong with them. And I want to kind of educate people. Let's get ahead of the curve. Let's be proactive rather than reactive.
Now, growing up, did you enjoy watching any of the medical shows? Did you see yourself wearing like a stethoscope or, Marcus Welby MD or,
Yeah, some of those shows,
okay.
Certainly. But I kind of feel when I have the time, I'm going to sit down and write a book.
Okay.
Certainly there's been a lot of patient instance. You're always surprised at what people can do or say. And it's amazing how some people have really changed the quality of their health because they've put the time and effort into caring for themselves.
Sometimes it's just like one of those like wake up moments. And I had asked you if it would be okay if you shared your own personal journey, because I thought it's good when a physician can almost like not just sympathize, but empathize. So can we talk about your journey?
Sure, okay. Absolutely. In 2001, I was in the midst of a major home renovation. I was also building up a practice that I had just joined. And I just wasn't feeling good. I was tired, I was run down, I was doing work on the house, putting a lot of hours into the office and the emergency room, and I said, let me just go get checked. And fortunately or unfortunately, I found out that I had cancer. And I can remember sitting in the radiology suite thinking, oh my gosh, Why me? What did I do? What did I not do? I was a two-sport college athlete. I always took care of myself. I exercised. I ate right. And I immediately changed that into, the heck of it, why me? I'm not going to let this slow me down. And it made me not only a better physician, because now I was walking around the hospital with my gown on and my butt hanging out.
I was going to say, you're hiding.
And poked and prodded. But it really made me focus more with my communication, not only with my patients, with my family as well. You know, they say, life is too short. And that was certainly a wake-up call and made me realize the preciousness of life.
My mom, as I had shared with you in the green room, battled with breast cancer for a really long time. And they told her she had 9 months to 3 years. And she's like, huh. And we were like, what does that mean? She's like, I got this. She ended up living 5 years because she wasn't going to let somebody tell her when she was going to die. She goes, I'm going to beat this thing. I'm going to make it, last. I'm going to do it to my best of ability to fight it. Right?
Sure. And there's an old quote that people have said, cancer doesn't just affect the patient, it affects the entire family.
Correct.
Because everybody has to battle it.
You're very philanthropic. We also talked about that.
Yes.
You go out of your way to try to make a difference in the lives of others. In particular, one of the you have friends that have charities that they've started. What is it like for you as a physician? To see great outcomes with your patients, but also to see a great outcome in your community.
So two of the organizations that I work with, one is called Angela's House. The other one is
Wait.
called. Okay.
Ding, 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 ding. Hold on just a second. I'm looking to the camera. That's one of my favorites, Bob Policastro.
Bob is a great man.
Love you. He just posted something on Facebook the other day, and I said, you know what? You're talking about you. He was talking about just being in service to others.
So friends of mine, their daughter was one of the first patients ever in their system, in their care.
Wonderful.
Almost 20 years ago.
Great. And they are for medically frail.
Medically fragile kids. Yep.
Kids, yeah. Fantastic.
Such a
So you
small
love
world,
working
right?
with Angela's House. Me too. Ding, ding, ding. And what is the other charity that you work with?
It's called Unsung Siblings. And that charity is geared towards the siblings of kids who have special needs. Because when there's kids that have special needs, obviously a lot of the resources are geared towards that special needs kid. And sometimes the siblings don't have as much care or attention, or sometimes their needs aren't met. So we try and help those siblings.
So both diabetes and obesity can be battled also by just through nutrition. I mean, sometimes you're still going to get sick anyway, but if you can kind of take care of, your heart health and eat right. And I had a guest today, we're talking about eating the rainbow. I don't do a very good job. Sometimes I'm so crazy busy, but I wish I had a personal chef. That might be a nice thing,
If you find one, send them my way.
I was going to say, yeah. I was like, where's Chris LaVecchia when you need him? But I think that is helpful, is through nutrition, through education, and I like that. That's what you bring to your practice. So
well, I tell people all the time, the choices that you make today, they only affect today and tomorrow. They affect next year, 5 years, 10 years, 15, 20 years down the line. So be smart in those decisions. It's all about balance.
I'm going to invite you now to my 100th birthday. It's
June
3rd of 2065.
Okay, I'll put
so
it on my
you're going to be, could you write it down? Let's test. Oh, thank you. It's a joy to meet you.
Pleasure.
Stay tuned for more. If you don't like your physician, pick another one. But this guy's cool. So, and thank you for watching. I'm Donna Drake.